staying with us here on Focus on Health. Remember, you can talk to us on our social media platforms, on Facebook at KUTV Kenya. Remember that with the end of the show does not mean that this will be the end of our discussion. Dr. Amanda, thank you very much for staying with us.
You're welcome.
Yeah. So in the first part of the interview, we did talk about the basic facts of meningitis. Yeah. Right now, we're really trying to get a little bit technical. And when you say technical, I really want to know about some of the strategies that the government maybe can put into place. When I talk about the government, I mean also the health workers can put into place to make sure that meningitis does not really become a menace.
True.
Yes.
One of the things we can do as health workers, and I think the government in general, is to deploy community health workers.
CHWs.
Yes, into the public. Because then you can be able to detect some of these patients, especially young children, before they get very ill. Second, you can be able to educate the public, educate mothers with babies, educate parents, educate generally just the people outside on the symptoms that they should watch out for, and inform them that when they get any of these symptoms, they should seek a health facility to be seen.
You did talk about CHWs, but you are a medical doctor, and but how feasible is this, CHWs? I
think it can be done because we've managed to do it with other conditions. The way we managed to eradicate polio in this country is by sending out community health workers to advise people on vaccinations. And we managed to be able to do it well. So even for meningitis, I think as long as you are able to educate them, it is possible for you to carry it through. Yes.
CHWs, the reason why I'm asking you this is because there have been a little bit of complaints or people who feel a little bit disenfranchised because CHWs are really a very integral part of any healthcare system, while they are really not remunerated, poor remuneration. Yeah. I know you're not you're not in a position to really talk about that, but if the ministry is watching you right now, what would you tell them in regards to remuneration of CHWs?
I think they're very important people in society. We need to be able to make them comfortable with the work they do. And if what they need is better remuneration, I think there's a way that the government should be able to look into it. Because at the end of the day, everybody wants to be able to support their families and support themselves. So because we need them to be able to eradicate some of these conditions, I think the government should seriously look into it.
Seriously look into it. But now coming back to our conversation on meningitis. So what is some of the prevention, or what are some of the ways that one can prevent meningitis onset?
Okay. One of them is the vaccination. You can get the meningococcal vaccine. Usually, I think it is given in the KP vaccination schedule. So parents with small children should ensure they get that vaccine.
Is it part of the vaccines that one has to, what do they call it?
Yes, it is in the KP schedule for vaccinations currently. So they should get the vaccine. Second is general cleanliness. So if you have somebody who is unwell, somebody who has an infection, you make sure that you always wash your hands before you handle children. You always wash your hands after dealing with somebody who is unwell. When you cough, always normal things. Cover your mouth, blow your nose, and discard whatever you've used properly. For things like boarding schools, you should always make sure that there's good ventilation, because then you're able to remove any infections which can be surrounding the air.
So when we talk about the need for having good ventilation, why is it really important in terms of meningitis? How does and that brings me to another question: how does meningitis spread?
Meningitis, the spread of meningitis is generally through what we call you spread it through infections. So usually upper respiratory infections. So for example, if you have a cold or you have a respiratory tract infection and you cough and I breathe in that air, it goes through the mucous membranes and then from there it spreads towards the rest of your systems. So mostly it's because of the mucous membrane. That is a barrier which is supposed to protect the rest of you. So what we would end up with is that if you have an infection and you're in an enclosed space, so I get the infection, and then now later on may result in me getting meningitis.
Is it airborne in simple terms?
It is. It is possible, yes, because these infections are airborne. Yes.
Do we have enough support from government in terms of fighting such conditions?
I think the government is trying,
yes,
because the availability of medication right now is better than what it was previously. So we are trying to be able to treat the disease. What we need to be able to do better is prevent people from getting the disease, which now would be, we need to increase the vaccination centers in the country, and we need to educate the public. Yes.
Complications that may come out, that may come as a result of meningitis? Death is one of them.
Yes.
In the first 24 hours?
Yes, it is possible.
Yeah.
You can have death in the first 24 hours.
But we have a rider to that. Only if maybe the treatment is not...
It depends on how fast you seek treatment,
yes,
and what type of meningitis you get. Like I told you, Neisseria, if you get the Neisseria infection, it can progress very quickly. So that one, despite you seeking treatment, the progression can be so quick that even when you get to the health facility, not much can be done. So ideally, once you get the symptoms, that is when we recommend that you go to a health facility at that time. Yes.
The complications.
Another one of the complications, it being an infection of the brain, sometimes you get patients, especially children, who get blindness. You can get children who get deafness. You can get children who get what we call deficits, neurological deficits. So they are unable to walk, or they can't move their hands, or their necks remain permanently in that position. That is one of the effects of long-term untreated meningitis. Yes. Do we,
when somebody goes, when somebody has this complication, do we have any going back, or do we have do we have a recovery for such patients?
That one, some people recover.
Yeah.
Although not fully recover from some of these serious complications. But you find, for the most part, if you get deafness, if you get blindness, recovery is very slow, if there is any at all. Yes. So you become permanently blind or permanently deaf. Yes.
And what's sad that you can become permanently blind or deaf for something that could have been...
That is treatable.
Yeah.
Yes. It is very unfortunate, which is why we recommend always seek treatment. If you're unwell, just go to the nearest facility and seek treatment. Yes.
Some people are asking on social media, one of the main questions that people are asking is that when you're having meningitis, can you just wish it away?
No, that is not a condition you would want to wish away. That is a condition you would want treated immediately. Because wishing it away now would put you in that position to get most of these complications, if not death. Yes.
Meningitis is not not only it's not really common in all the regions in Africa. We realize that it's more common in the northern part of the country. Why is this the case? We have so many things happening in the northern part of the country that we won't wish meningitis to be part of it. On a lighter note, though.
Well, I can't really tell why it is more common in that area. I think that would require
more research. Yeah.
Yes. But
could it because of the health facilities they don't have?
That is true. They don't have a lot of them.
Access.
Secondly, they are nomadic people in that area. So by the time they get from one place to another, perhaps in the in-between, there's no chance of them seeking any health facility or any healthcare intervention. Yes.
Dr. Do you have any final words for us?
I do, as a matter of fact.
I can maybe you can talk to our viewers from that camera there.
All right.
Yeah.
If you have any patient whom you think might be having meningitis, if you have any patient who presents with the symptoms of meningitis, kindly take them to a hospital as quickly as possible. It is a condition we can treat, but it is also a condition that can be fatal. So the faster we treat, the better it is for the patient to recover. Yes.
Thank you very much, Dr.
You're welcome.
Such a very good parting shot from you.
Yes.
And I guess that it's because of maybe the time and the experience that you have been handling such cases.
Yes.
Yeah. But for our viewers back at home, that is all we had for you here on Focus on Health. And remember that you can talk to us on our social media platforms. You can talk to us on our Facebook. And remember that the end of the show does not mean that will be the end of us focusing on your health. I've been your host, Omo.